Welcome to Lesson 5 of the Porn Conversation Curriculum and Activity Guide. Today, you're going to learn about sexual health. This is a lot of information. Just soak all the information in. Don't feel like you need to get it all right on a test. Just allow it to fill your brain. Whether a person is sexually active or not, knowing your choices when it comes to taking care of your sexual health is important. It helps you understand self-care, have pleasurable relationships, and maybe even start a family one day. Sexual health is a huge part of our lives, and understanding how sex works, our choices when it comes to having sex, consequences of having sex, and how we can best take care of our bodies is all important. Sexual behavior is the state of being sexual, which can be expressed in more ways than just penetration. The way people choose to express their sexual orientation through their behavior is up to them and what they and their partners find pleasurable. Sexual behaviors range on a wide spectrum, from solitary behaviors like masturbation to partnered behaviors like engaging in oral sex, anal sex, vaginal sex, non-penetrative sex, or outercourse like cuddling and mutual masturbation. The good thing to remember is that everyone finds different things pleasurable. There's no such thing as normal sexual behavior. It varies from person to person. Many people will choose not to have sex. Others may have sex but not sexual intercourse. Let's discuss the different approaches to having sex. Abstinence is the choice not to engage in all or some sexual behavior. It means different things to different people. For some, abstinence means not engaging in all sexual behaviors. For others, it means not engaging in some sexual behaviors, like penetration. Some people choose to be abstinent just for a period of their lives. For example, they may choose to remain abstinent until marriage. Others may choose to remain abstinent for longer or shorter periods of their life. A person can choose to be abstinent even if they've had sex before. A person's choice to remain abstinent should always be respected. Abstinence is common. We actually abstain from sex most of our lives. In general, people are not having sex all of the time. Sexual intercourse is any type of penetrative sex, including vaginal and anal sex. Outercourse is any type of sexual activity that doesn't include sexual intercourse. Things like kissing, cuddling, dry humping, genital rubbing, oral sex, mutual masturbation, to name a few. But be aware, when there is skin-to-skin contact of the genitals or genital region, it can still lead to a higher risk of transmitting sexually transmitted infections. Once a person begins to go through puberty, it's possible to get pregnant or get someone else pregnant. That's why it's important to be familiar with the different ways pregnancy happens. Also, your pregnancy options and ways to prevent pregnancy in the first place. Pregnancy happens when an egg and sperm join in a process called fertilization. A vulva owner is in the most fertile phase in their menstrual cycle, or ovulation, when pregnancy occurs. During vaginal intercourse, the penis ejaculates semen inside the vagina. The semen contains sperm, which then enters the cervix. Some of those sperm may eventually reach an egg that has been released into the fallopian tube. If it joins with the egg, the fertilization process takes place. The fertilized egg then travels to the uterus and attaches itself to the uterine wall. But pregnancy doesn't always have to involve vaginal intercourse. It can also happen through various medical processes. There are a few signs of early pregnancy which may include, but aren't limited to, a missed period. But please note, a missed period can also happen when someone has just started menstruating, so it's not always a sign of pregnancy. Another sign is morning sickness, which is nausea and vomiting. This typically occurs during the first few months of the pregnancy. Experiencing all or some of these symptoms doesn't always mean a person is pregnant. The best way to know whether or not a person is pregnant is through a pregnancy test, where urine is tested for a certain hormone that's released once the fertilized egg implants in the uterus. If this hormone is found, it's likely that person is pregnant. Pregnancy tests can be bought at a grocery store, a discount store, a pharmacy, or through a healthcare professional. If a person becomes pregnant, it's important to know all the options that person has. There are 3 choices a person has when they become pregnant. 1, parenting. They can give birth and raise a child. 2, abortion. They can terminate or end the pregnancy through a medical procedure or medication. Depending on your location, this may be legal or not. 3, adoption, which is the choice to give birth and permanently place the child with another family. The choice a pregnant person makes is based on lots of different things, including their values, health, and economic stability. If a person chooses to stay pregnant, there are major parts of pregnancy and fetal development, which we'll go over now. Human pregnancy lasts about 38 weeks from the time of fertilization. It's divided into 3 periods of 3 months, which we call trimesters. The beginning of the first trimester is considered the first day of the person's last period. 1 missed period is equal to 4 weeks of pregnancy. During the first trimester, all the major organs and structures of the embryo's body begin to form. After week 8, the embryo is called a fetus. If someone is choosing to terminate the pregnancy, this is often the time people do so. There are 2 options to terminate a pregnancy. There are pills one can take which result in bleeding, kind of like having a heavy menstrual cycle. Or there's the option of an in-clinic abortion, where a medical provider uses tools to gently empty the uterus. The second trimester includes week 13 to 28. The fetus grows at a fast pace, and around week 19, the pregnant person can feel the fetus move. Abortion may still be possible at this point for some people, especially if the organs or brain activity aren't developing like they need to in order to survive after birth. The third trimester is 29 to 38 weeks. The fetus continues to grow and gain weight, and the movements become stronger until birth. Doctors agree that by week 32, fetal pain is felt, meaning the fetus can feel pain. Termination is rare at this time, but may be considered if the fetus is in pain or if the pregnancy places the person at risk of dying. There are many different ways a pregnancy can occur without vaginal intercourse, too. Let's go over some ways that can happen. Many people who want to become parents can't reproduce. Some people have difficulty getting pregnant, others don't have a sexual partner, or they have a partner of the same sex. These people may seek other ways to have a baby. Some of these other methods include in vitro fertilization, or IVF. This is when the sperm and the egg are joined together in a laboratory, and then the fertilized egg is inserted into the uterus. Surrogacy. When someone arranges for another person, or surrogate, with a uterus to carry the baby all 9 months, or full term, the surrogate becomes pregnant through the use of IVF. Artificial insemination. When semen is inserted into the vagina during ovulation. Ovulation is the time of month the uterus owner is most fertile and able to make a baby. A miscarriage is the involuntary loss of pregnancy. The majority of miscarriages occur during the first trimester, but sometimes may occur in the second trimester too. A miscarriage can be an emotionally and physically challenging experience. Experiencing a miscarriage is never the fault of the pregnant person. It's usually caused by random abnormalities in the chromosomes while the fetus is developing. This can range from the fetus missing chromosomes or developing extra chromosomes. It's the body's natural way of ending a pregnancy, where the fetus couldn't survive. A miscarriage does not typically mean that a person can't get pregnant in the future. During a miscarriage, a person typically experiences cramping, bleeding, and discharge, much like they would during a heavy period. The bleeding will lessen over a couple days. Menstrual products like high absorbent pads are necessary until the bleeding stops. If someone miscarries and experiences a high fever, cramping, severe pain, or heavy bleeding beyond the first few days after the first sign of a miscarriage, they should definitely go seek help from a medical professional. Please note, this section starts with a content warning. This is not to change your belief about abortion. It is to inform. Use it as you need. A person may not choose to terminate a pregnancy for many reasons. And when one does choose to terminate, it's not an easy decision. Most abortions occur within the first trimester of a pregnancy. If a person chooses to terminate a pregnancy, they have choices which include surgical in-clinic abortion. The same-day procedure is carried out at a medical clinic or hospital. It's a surgical procedure that removes the pregnancy from the uterus. Sometimes anesthesia will be administered, but it is not always requested and/or necessary. Once the surgery has been completed, usually in less than 10 minutes, the patient can go home. It's considered an outpatient surgery. Another option is the abortion pill. A pregnant person will be given 2 pills to take usually within a day or 2 apart. The pills will stop the pregnancy from growing and cause the lining of the uterus to thin. This causes the termination of the pregnancy. The pregnant person will bleed for a few days and the termination is complete. For both types of abortion, the patient will typically experience some cramps, much like they would during a heavy period. The bleeding will lessen over a few days and can last for 2 weeks. People must use menstrual products like high absorbent pads on their underwear until the bleeding stops. The risk of a potential transmission of sexually transmitted infections, including HIV, from a variety of sexual behaviors is common, but there are always ways we can practice safer sexual behaviors to reduce that risk. A sexually transmitted infection, or STI, is an infection that's transmitted from sexual contact with a person who's tested positive for an STI or has an STI during vaginal, anal, and oral sex. STIs are very common. You can only transmit or be exposed to an STI by engaging in sexual behavior with someone who has an STI. This also includes people who don't know their STI status. Most STIs are curable, but some, like herpes and HIV, aren't. But all STIs are treatable and preventable.
How are STIs transmitted?
Not all STIs are transmitted through sexual intercourse. Some can be passed on through skin-to-skin contact. Some STIs may be passed on from the pregnant person to the baby during pregnancy, childbirth, or breastfeeding.
How are STIs not transmitted?
STIs are not transmitted through casual contact, like hugging or holding hands. Some ways of reducing the risk of STI transmission include remaining abstinent, communicating with your sexual partners about ways you can be intimate without the risk of an STI transmission, for example, outer course, getting tested by a healthcare provider. This is the only way to really know someone's STI and HIV status, and your own. And if you test positive, speak with your healthcare provider about treatment. Providing safer sex by using barrier method contraceptives during anal, vaginal, and oral sex. Getting vaccinated for HPV, human papillomavirus, and hepatitis B. There are 2 types of infections when it comes to STIs. Bacterial. A bacterial infection is caused by a bacterial organism, and the active infection can be cured through the use of antibiotics. Viral. A viral infection is caused by a virus and cannot be cured. Although the virus will remain in the body for life, symptoms may not always be present, much like the virus that gives you the common cold. Lots of the stigma and myths surrounding STIs and HIV come from false information. Let's go over some of these myths. Myth number 1. Having an STI is dirty, embarrassing, or shameful. Having an STI is nothing to be ashamed of. Many people get them, and there are lots of medications out there that help treat and often even cure them. Myth number 2. A person who is STI positive has sex with a lot of people. STIs are common. It's possible to get an STI even if it's the first time you have sex or share some sexual touch. Some people are born with an STI. Myth number 3, you can tell if someone has an STI by checking their genitals. No. STIs, including HIV, do not always show symptoms. The only way to truly know if a person has an STI is by being tested by a doctor on a regular basis. Myth number 4, you can get HIV from being touched by an HIV positive person. HIV is not transmitted through non-sexual contact, like hugging or sharing a bathroom or being touched. Myth number 5, you can only get HIV through sex. Not true. It can also be transmitted through sharing needles or syringes, or through blood transfusions with infected blood that has not been tested, or from an HIV-positive pregnant person who is not treated. HIV can be transmitted to the baby during pregnancy or during breastfeeding. Myth number 6. STIs will go away on their own. Always, always, always check in with a medical professional. There are medications, vaccines, and protections available that, when used properly, can lower the risk of giving and getting STIs, including HIV. The most common sign or symptom of an STI is no symptom at all. This is why testing for STIs regularly when you're engaging in sexual behavior is important. Let's discuss the following STIs, their symptoms, treatment, and their potential impacts. Chlamydia. What are the symptoms of chlamydia? The majority of people who test positive for chlamydia do not experience symptoms. If they do, vulva owners may experience abnormal vaginal discharge that's yellow and pus-like, and or a burning sensation when they pee. Penis owners may experience white or mucus-like penile discharge and a burning sensation when they pee. Is it curable? Yes, through antibacterial medication. Is there a vaccine? No. What's the potential impact? Well, if left untreated, chlamydia may cause pelvic inflammatory disease in vulva owners, which can cause infertility. Gonorrhea. What are the symptoms of gonorrhea? The majority of people who test positive for gonorrhea do not experience symptoms. If they do, vulva owners may notice abnormal vaginal discharge that's thick and looks a bit green or yellow. They may also feel a burning sensation when peeing. Penis owners may notice penile discharge that looks white, yellow, or greenish and feel a burning sensation when peeing. Is it curable? Yes. Is there a vaccine? No.
Nope.
The potential impact? Well, if left untreated, gonorrhea may cause pelvic inflammatory disease in vulva owners, which can cause infertility. Hepatitis B. What are the symptoms of hepatitis B? Some people may experience flu-like symptoms and jaundice, which can cause the yellowing of the eyes and skin. They may also notice their urine looks very dark. Is it curable? Although there is no medicine that cures hepatitis B, many people's immune system will fight off the infection naturally over time. Is there a vaccine? Yes. The hepatitis B vaccine effectively protects you from getting the infection. Are there potential impacts? Sometimes hepatitis B causes chronic liver illness. Herpes, HSV2. What are the symptoms of herpes simplex virus 2? Well, some people never show any symptoms at all, while other people may experience flu-like symptoms and painful reoccurring sores on the genitals or surrounding areas. Is it curable? No, but symptoms are treatable through antiviral medications, which can help reduce the intensity and frequency of symptoms. Is there a vaccine? No. Are there potential impacts? Well, besides discomfort, scarring, and pain, shame is the worst impact of this infection. Herpes is one of the most stigmatized STIs. HIV, or human immunodeficiency virus. What are the symptoms of HIV? HIV often does not show any symptoms, but it can cause flu-like symptoms 2 to 4 weeks after exposure. Is it preventable? Yes, through abstinence or by correctly using condoms and dental dams. Is it curable? No, but it's treatable through the use of antiviral medication, which can lower or stop the virus from transmitting to others during sex. Is there a vaccine? No, but there's PrEP and PEP, which are medications used to greatly reduce the risk of transmission of HIV. PrEP is an extremely effective daily or on-demand pill that can be taken by HIV-negative people to reduce the risk of getting HIV. PEP is a short-term treatment for people who, within the past 72 hours, have been exposed to HIV. For instance, being pricked with an infected needle or having unprotected sex with someone who's HIV positive. PEP helps prevent someone from getting an HIV infection by stopping the virus from establishing itself in the body. PEP is a very harsh treatment and will make you feel sick while taking it because it's helping your immune system fight off any foreign invaders. Headaches, nausea, diarrhea, and vomiting are common side effects of PEP. What are the potential impacts of HIV? If left untreated, HIV can lead to acquired immune deficiency syndrome, AIDS, which can cause various infections and other life-threatening illnesses. Human papillomavirus, or HPV. What are the symptoms of HPV? HPV often does not show any symptoms. Some types of HPV can cause genital warts and genital cancers. Is it curable? No, but the symptoms can be controlled through treatment, and some types of HPV are cleared out naturally over time through your immune system. Is there a vaccine? Yes. The HPV vaccine is available to protect against the types of HPV that can cause genital warts and cancer. It's recommended that people receive the vaccine before they become sexually active. Vaccines are available for all genders starting in early adolescence. Are there potential impacts of HPV? There are some types of HPV that can cause different types of cancers, including cervical cancer in vulva owners and penile cancer in penis owners. Syphilis. What are the symptoms of syphilis? There are 3 stages to a syphilis infection. In the first stage, there can be painless sores on the genitals, anus, or mouth. In the second stage, rashes may show up and flu-like symptoms may occur. In the third stage of syphilis, symptoms can start to go away on the outside but begin to cause more serious issues to your internal organs and your brain. Is it curable? Yes, it's easy to cure if treated early. Is there a vaccine? No. What are the potential impacts? If left untreated, the third stage syphilis can cause damage to the nervous system, including your brain, and may even cause death. Is it preventable? Yes, through abstinence or by correctly using condoms and dental dams. Trichomoniasis, or trick. What are the symptoms of trichomoniasis? Majority of people who test positive for trick don't have any symptoms or have very mild symptoms. Penis and vulva owners may experience itching, discomfort, unusual discharge, and painful urination. Symptoms can come and go, but your body needs medicine to fight it. Is it curable? Yes, through the use of antibiotics. Is there a vaccine? No. Are there potential impacts? Yes. Trick can cause vaginitis in vulva owners, which may cause irritation or inflammation of the vulva and abnormal vaginal discharge. Is it preventable? Yes, through abstinence or by correctly using condoms and dental dams. Yeast infections. What are the symptoms of a yeast infection? Vulva owners may experience abnormal vaginal discharge that may look white and watery or thick in texture. They may experience a burning sensation when peeing and overall discomfort, swelling, or redness of the vulva. Penis owners may experience white penile discharge and feel itching and burning sensations on the penis. Is it curable? Yeah, it can be treated with antifungal medication. Is there a vaccine? No. Are there potential impacts? Yes. If left untreated, the infection will continue to spread and could lead to a skin infection and increased feelings of discomfort. Is it preventable? Yeah. To prevent spreading a yeast infection through sexual contact, use condoms and dental dams. There are steps vulva owners can take to help lower the risk of getting a yeast infection without sexual contact too. Step 1. Use scent-free products when cleaning your vulva. Step 2. Don't douche or use cleaning products in the vaginal opening. Goodbye. Step 3. Vulva owners should always wipe from front to back after going to the bathroom. Step 4. Wear breathable underwear made from natural fibers like cotton that doesn't hold heat and moisture. Step 5. Immediately change out of damp or wet clothes. Step 6. When using a panty liner, change it every 6 to 8 hours at least. Urinary tract infections, or UTIs. What are the symptoms? Symptoms of a UTI for penis and vulva owners may include a burning sensation when urinating, or the urge to urinate more frequently, fever, lower stomach or back pains, cloudy colored urine, or blood in the urine. Is it curable? Yes. A UTI can be treated with medication. Is there a vaccine? No. Are there potential impacts? Yes. If left untreated, it can cause permanent damage to the kidneys. There are steps that can be taken to help lower the risk of getting a UTI. Urinating frequently, especially after sexual intercourse. Drinking lots of water every day. For vulva owners, wiping from front to back after using the toilet. Crabs or pubic lice. What are the symptoms? For both penis and vulva owners, symptoms may include intense itching of the pubic hair and sometimes in thin hair like the eyebrows or eyelashes. The presence of very tiny tan or white colored bugs and oval yellow or white colored eggs or nits that attach themselves to the pubic hair. Sometimes a person may experience a fever too. Is it curable? Yes, through the use of gels and shampoos that effectively kill the crabs or pubic lice. Medication is also available for those that have more intense cases if the shampoos aren't effective. Is there a vaccine? No. Are there potential impacts? Well, if left untreated, the crabs or pubic lice will continue to multiply and feelings of itching, physical, and mental discomfort will increase. Is it preventable? Yes, through abstinence. Over the past few decades, there have been medical breakthroughs in HIV prevention and treatment, which is why HIV is now considered a chronic condition and not a life-threatening virus. People who are HIV positive are considered people living with a disability. HIV is now considered a chronic condition and not a life-threatening virus due to the medical breakthroughs in the treatment of the virus, using antiviral medication and the preventative methods of PrEP and PEP. PrEP is pre-exposure prophylaxis, which means it's a treatment given to prevent a disease before being exposed to it. PrEP is an extremely effective daily pill that may be taken by HIV-negative people to reduce the risk of transmission of HIV. PrEP reduces the risk of getting HIV from sex by about 99% when taken as prescribed. If used along with barrier contraceptives, this reduces the risk of transmission even more. PEP is post-exposure prophylaxis, which means treatment given to prevent a disease after being exposed to it. PEP is a short-term treatment for people who've already been exposed to HIV within the past 72 hours. PEP helps prevent someone from getting an HIV infection by stopping the virus from establishing itself in the body. It's also often part of a rape kit procedure at hospitals for victims of sexual assault. PrEP and PEP are recommended for HIV-negative people who are considered to be particularly vulnerable to HIV, like people who are sexually active with an HIV-positive partner, people who have anal or vaginal sex with partners who have been diagnosed with a sexually transmitted infection within the past 6 months. If a person has a sore or an outbreak from an STI, it increases the risk of transmission of HIV since the virus can more easily enter the body through that open sore. People who don't or didn't use protective barriers, such as condoms, and have one or more sexual partners whose HIV status is unknown, or people who share needles and syringes. It's important to understand that there's no such thing as safe sex, but we can always practice safer sexual behaviors. When engaging in sexual behavior, there are consequences to be aware of, like pregnancy or the potential transmission of STIs, including HIV, pleasure, intimacy, etc. STI transmission is a risk you take during vaginal, anal, and oral sex, and any other sexual behavior that includes skin-to-skin contact. You can reduce the risk of STI transmission or pregnancy by communicating before having sex, getting tested regularly, and by using contraceptives during any type of sexual behavior. Now, let's talk about contraception. Please get out your contraception worksheet and fill it out as we go along. Some short-term contraception options include hormonal contraception. Hormonal methods of contraception are those that contain either the hormones estrogen and progestin together or progestin only. Some examples of hormonal contraceptives include birth control pills. Locate birth control pills on your worksheet. The birth control pill works by thinning the uterine lining, thickening cervical mucus, and limiting ovulation to a particular time during menstruation. It tries to prevent fertilization. How effective against pregnancy is it? 91% effective when used consistently and correctly. How long does it last? Packs usually last for 1 month. Does it protect against STIs and HIV? No. Are there side effects? Birth control pills may cause sore chest tissue, headaches, nausea, and vaginal bleeding or spotting between periods, otherwise known as breakthrough bleeding. Hormonal injection. How does it work? An injection is given every 1 to 3 months, which contains the hormone progesterone that prevents ovulation and thickens cervical mucus. How effective against pregnancy is it? 94% effective. How long does it last? 1 to 3 months, depending on the injection. Does it protect against STIs, HIV? No. Are there side effects? The hormonal injection may cause changes in your period. That may include no bleeding or breakthrough bleeding. The vaginal ring. How does that work? The vaginal ring is a thin, flexible ring that is inserted into the vagina by the vulva owner or medical provider. The ring slowly releases hormones, which stop ovulation, and thickens the cervical mucus and stops the sperm from joining with an egg. How effective against pregnancy is it? 91% effective. How long does it last? The ring must be replaced each month. Does it protect against STIs, HIV? No. Are there side effects? The vaginal ring may cause nausea, headaches, sore chest tissue, changes in menstrual cycle, spotting or breakthrough bleeding, and increased vaginal wetness. Now locate the hormonal patch on your worksheet. The hormonal patch is a small adhesive patch, and it's applied to the skin and slowly releases hormones, which stop ovulation and thickens the cervical cervical mucus to prevent the sperm from joining with an egg. At this time, the hormonal patch is only available in one color, primarily for lighter skin tones. The lack of availability of people of color-centered options makes the hormonal patch stand out more on darker skin tones than it does on light skin. This is yet another example of the effects of white supremacy in sexual and reproductive health, where white and lighter skin color is seen as the norm. Moving on. How effective against pregnancy is the hormonal patch? 91% effective when used consistently and correctly. How long does it last? The patch must be replaced weekly. Are there any side effects? The hormonal patch may cause changes in your period that may include no bleeding or breakthrough bleeding. Intrauterine device, or IUD. How does it work? The IUD is tiny, soft rod implants that are inserted into the uterus. IUDs work by shifting the way sperm travels to the egg, which prevents pregnancy. How effective against pregnancy is it? 99% effective. How long does it last? Depending on the type of IUD, it can last from 3 to 12 years. It requires a medical provider to remove. Does it protect against STIs, HIV? No. Are there side effects? The IUD may cause pain, like back pain and cramping, after being inserted. It may also cause changes in menstrual cycle and spotting or breakthrough bleeding. Some IUDs have hormones that pause menstrual bleeding altogether. The birth control implant. How does that work? The birth control implant is a tiny, thin rod about the size of a matchstick. A doctor inserts the implant under the skin of your upper arm. It releases the hormone progestin to stop you from getting pregnant. How effective against pregnancy is it? 99% effective. How long does it last? Up to 5 years. It requires a medical provider to remove it. Does it protect against STIs and HIV? No. Are there any side effects? Following insertion, the birth control implant may cause spotting or breakthrough bleeding and changes in the menstrual cycle. Some short-term, non-hormonal contraception methods do not contain or affect a person's hormones. Methods containing spermicide typically have very little to no side effects on the user, unless they or their partner have an allergy or experience irritation. Some non-hormonal contraception options include the diaphragm. The diaphragm is a shallow rubber cup that is filled with spermicide and inserted into the vaginal opening. The diaphragm covers the cervix and prevents sperm from entering, and the spermicide kills the sperm. How effective against pregnancy is it? 88% effective when used consistently and correctly. How long does it last? It must be replaced after each use. Does it protect against STIs and HIV? No. The cervical cap. Cervical cap is a thin latex cup that is filled with spermicide and inserted into the vagina and held in place by suction. The cap covers the cervix and prevents sperm from entering, and the spermicide kills the sperm. How effective against pregnancy is it? 71 to 86% effective when used consistently and correctly. How long does it last? It must be replaced after each use. Does it protect against STIs and HIV? No. The sponge. The sponge is a small round sponge made from soft, squishy plastic that contains spermicide. The sponge is placed deep inside the vagina. The spermicide kills active sperm and prevents it from reaching the cervix. How effective against pregnancy is it? 76 to 80% effective when used consistently and correctly. How long does it last? It must be replaced after each use. Does it protect against STIs and HIV? No. Contraceptive suppositories. A small solid form of spermicide that is inserted into the vagina as close to the cervix as possible 10 minutes before sexual intercourse. Once inserted, it will dissolve into a foamy substance to block and kill sperm. How effective against pregnancy is it? 70 to 80% effective when used consistently and correctly. How long does it last? It must be reinserted after each use. Does it protect against STIs and HIV? No. Contraceptive film. Contraceptive film is a thin sheet of film, much like the texture of wax paper, that's folded up and inserted into the vagina as close to the cervix as possible. The film will melt into a gel to block and kill sperm. How effective against pregnancy is it? 70 to 80% effective when used consistently and correctly. How long does it last? It must be reinserted after each use. Does it protect against STIs and HIV? No. Non-hormonal or copper intrauterine device, or IUD. A copper IUD, or non-hormonal IUD, is a tiny rod implant made of plastic and wrapped with copper, and it's inserted into the uterus. A non-hormonal IUD works by shifting the way sperm travels to the egg, which prevents pregnancy. It can also be used as a form of emergency contraception if inserted within 120 hours after having unprotected sex or a contraceptive failure, like a condom breaking. It's more than 99.9% effective against pregnancy when used as an emergency contraception. How effective against pregnancy is it otherwise? 99% effective. How long does it last? Up to 12 years. It requires a medical provider to remove. Does it protect against STIs and HIV? No. Are there any side effects? The IUD may cause pain, which includes back pain and cramping, for a few days after being inserted. Changes in menstrual cycle and spotting or breakthrough bleeding also may occur. Some long-term contraception options include sterilization, which is a surgical procedure that permanently prevents pregnancy. Sterilization methods of contraception include tubal ligation. Tubal ligation is a surgical procedure that permanently cuts, closes, or removes parts of the fallopian tubes. The fallopian tubes play a role in transporting the eggs to the ovaries, and tubal ligation blocks this process from happening. How effective against pregnancy is it? 99% effective. How long does it last? It's permanent. Does it protect against STIs and HIV? No. Vasectomy. A quick and simple surgical procedure that cuts and closes the vas deferens tubes, which keeps sperm out of the semen. How effective against pregnancy is it? 99% effective. How long does it last? Ideally, these last the person's lifetime, but there are some times when it can be reversed. Does it protect against STIs and HIV? No. Hysterectomy. Hysterectomy is a surgical procedure done to remove the uterus, fallopian tubes, ovaries, and cervix. Once removed, the person will stop menstruating. How effective against pregnancy is it? 100% effective. How long does it last? It's permanent. Does it protect against STIs and HIV? No. Barrier method contraceptives act as a barrier between another person during skin-to-skin sexual contact. Locate those on your worksheet. These are the only type of contraceptives that offer protection against STIs. Barrier methods of contraception options include the external condom. The external condom is a thin pouch made out of latex that's rolled over an erect penis during or before sexual activity. It prevents semen and or vaginal fluid transmission. How effective against pregnancy is it? 85 to 90% effective when used properly and consistently. When used in combination with other contraceptives, it is the most effective way of avoiding pregnancy in vulva owners during penis in vagina or PIV sex. How long does it last? It must be replaced after each use. Does it protect against STIs and HIV? Yes! Using an external condom each time a person has vaginal, anal, or oral sex reduces the possibility of transmission of STIs and HIV. Lambskin condoms do not protect against STIs. Only latex and polyurethane condoms do. Are there any side effects? Potentially lowered levels of sensation, and some may experience skin irritation or allergic reactions to certain materials in external condoms. Internal condom. An internal condom is a lubricated latex pouch with 2 rings at each end. One of the rings is inside the pouch. That inside ring is inserted into the vagina and is held against the cervix by the pelvic bone. The outer ring remains outside the vagina. It can be inserted hours before sexual activity begins. How effective against pregnancy is it? 79 to 85% effective when used properly and consistently. When used in combination with other contraceptives, it is the most effective way of avoiding pregnancy in vulva owners during penis in vagina or PIV sex. How long does it last? It must be replaced after each use and must be removed by twisting the outer ring to close and gently pull out so no semen is spilled. Does it protect against STIs and HIV? Yes! Using an internal condom each time a person has vaginal or anal sex reduces the possibility of transmitting STIs and HIV. Are there any side effects? Potentially lowered levels of sensation, and some may experience skin irritation or allergic reactions to certain materials of internal condoms. There are many different kinds of contraceptives that are available, but many require a prescription. The types of contraceptives that have greater access and availability without a prescription include abstinence, condoms, emergency contraception, and withdrawal. Let's discuss how these work. Abstinence. How does it work? Typically, a person who is abstinent is someone who chooses not to have any or some type of sexual activity. Abstinence means different things to different people. Some choose to abstain from vaginal sex, but other sexual activities are okay. How effective against pregnancy is it? 100% effective if abstaining from vaginal sex. How long does it last? The amount of time a person chooses to remain abstinent. Does it protect against STIs and HIV? Yes, if there's no skin-to-skin contact. Are there any side effects? Some people who choose abstinence may experience feelings of peer pressure, confidence, and security in their relationships with themselves and others. Emergency contraception, or the morning after pill. How does it work? This is a pill that prevents pregnancy when taken up to 3 days after having unprotected sex. It can also be used after an experience of contraceptive failure, like if a condom breaks during vaginal intercourse, or if a person forgets to take their birth control pill. Morning after pills work by temporarily stopping a person's ovary from releasing an egg. It thins uterine lining and thickens cervical mucus. How effective against pregnancy is it? The sooner it's taken after unprotected sex, the better chance it has at being effective. Morning after pill is 95% effective within 24 hours. 85% effective within 24 to 48 hours, and 58% effective if taken from 48 to 72 hours after unprotected sex. How long does it last? Just that one time. It does not replace future contraceptive use. Are there any side effects? The morning after pill may cause fatigue, nausea, vomiting, headache, chest tissue soreness, and changes in menstrual cycle. Withdrawal. Withdrawal, often referred to as the pull-out method, is a high-risk contraceptive method for pregnancy and STI and HIV transmission, especially when not used in combination with an internal or external condom. Withdrawal is the action of pulling out the penis before ejaculation. Ejaculating outside of the vagina prevents pregnancy, but even the smallest amount of semen from ejaculation or pre-ejaculation may cause pregnancy. This is not a reliable contraceptive method. Condoms can be put on anything used for penetration. Learning how to use a barrier method correctly is an important part of your sexuality. Here is a step-by-step method as to how to use barrier methods. This takes practice, meaning more than just this lesson. Let's start with external condoms. Pre-steps. When using an external condom, knowing what type of material is body safe for all partners is important. Do you or a partner have a latex allergy? Is the external condom in a good condition? Has it been stored in a material safe environment, which is cool and dry space? Or has it been stored in an unsafe environment, wet, hot space? Step 1. Check the expiration date, the packaging, and make sure there are no holes or tears. Step 2. Carefully open and remove the external condom from the package to prevent tearing. Step 3. Check that the condom is ready to roll down the right way. The condom's rim should appear on the outside so it can be unrolled easily. Step 4. Place the condom on the head of the erect hard penis. If intact, you may need to pull back the foreskin first. Step 5. Pinch air out of the tip of the condom. Step 6. Unroll the condom all the way down the penis. Step 7. Before pulling out the penis after ejaculation, hold the condom at the base of the penis. Then pull out the penis while holding the condom in place. Step 8. Carefully remove the condom. Tie it in a knot so semen does not come out, and throw it in the trash. Internal condoms. Pre-steps. When using an internal condom, knowing what type of material is body safe for all partners is important. Is the internal condom in a good condition? Has it been stored in a material safe environment, cool and dry space? Or has it been stored in an unsafe environment, a wet and hot space? Step 1. Check the expiration date and that the packaging is in good condition and make sure there are no holes or tears. Step 2. Carefully open and remove the internal condom from the package to prevent tearing. Internal condoms are extremely lubricated and may be harder to hold and keep a grip on than an external condom. Step 3. The thick inner ring with a closed end is used for placing in the vagina or anus and holds the condom in place. The thin outer ring remains outside of the body, covering the vaginal opening or opening of the rectum. Step 4. Find a comfortable position. While holding the outside of the condom at the closed end, squeeze the sides of the inner ring together with your thumb and forefinger and insert into the vagina or anus. It is similar to inserting a tampon or a menstrual cup. Step 5. Using your finger, push the inner ring up as far as it will go until it rests against the cervix, or push as far up into the rectum as you can. The condom will expand naturally and you may not even feel it. Step 6. Be sure the condom is not twisted by inserting your fingers inside the vagina or anus to feel that it is in place. Step 7. Check that the thin outer ring is located outside the vaginal opening or anus. Step 8. Guide partner's penis or adult toy into opening of the internal condom. Stop intercourse if you feel penis or adult toy slip between the condom and the walls of the vagina or anus, or if the outer ring is pushed into the vagina or anus. Step 9. To remove, Gently twist the outer ring and pull the internal condom out of the vagina or anus. And step 10, throw away internal condoms in the trash after using it one time. Do not reuse. Again, the internal condom is extremely lubricated and not always easy to hold and keep a grip on. This can make it a challenge early on, but continue to practice if it is a method that is of interest to you. Dental dams. A dental dam is a thin, flexible piece of latex that protects against direct mouth-to-genital or mouth-to-anus contact during oral sex to reduce STI transmission. It is placed directly onto the anus or vaginal opening before oral sex. Using a water-based lubricant between the dental dam and the skin can help keep the dental dam in place and prevent it from slipping. Dental dams are not easily found, but they can easily be made out of external condoms. How to make a dental dam using an external condom. Open the condom package and unroll the external condom. Snip the tip and the rolled end of the condom. Cut along one side of the condom. Roll out the latex sheet and use it in place of an official dental dam. Remember, STIs are common. Using a barrier every time you engage in sexual skin-to-skin contact is the best way to reduce the risk of transmitting and spreading STIs. Yeah!